Welcome to my poster on Midwest health disparities in pregnancy outcomes before, during, and after COVID-19. My name is Alyssa Schumacher. I am an undergraduate research student in the Strom Lab at Sanford Research. In our study, we examine the effect that the psychosocial stress of COVID-19 had on weight and gestational length, or preterm birth rates, among pregnant individuals affected by the pandemic, with a special attention to the impacts to people of historically underprivileged racial and ethnic backgrounds. Specifically in our study, we focused on African American or Black, Indigenous American, and white communities. Previous research has shown that marginalized racial and ethnic groups experienced higher levels of stress during the pandemic due to both COVID stress and other racially driven social stressors. There is also previous literature discussing how individuals disadvantaged by their racial or ethnic identity have smaller babies on average. These factors align with evidence from multiple studies tying social stress to adverse effects on birth weight and gestational length in pregnant women. Because of this, we expected that COVID-19 stress would have a greater impact on the birth outcomes of women from historically undervalued racial and ethnic backgrounds. Our data set included 9,541 preemie between the ages of 18 and 45 and who had a gestational length of less than 43 weeks. The data spanned from April 2011 to September 2022 and was split into three distinct COVID epochs centered around February 25, 2020, the day that COVID began to have an impact in the United States. We chose this date as it is the day the CDC first released a statement announcing that the general public could expect severe disruption to their lives. All births prior to February 25th are included in the before period. This period encompasses all women who did not have their pregnancies affected by COVID-19. The transitional period spanned all births from February 25th to December 15th, 2020. This epoch includes all individuals who had their pregnancies affected by the start of COVID in the US. The third epoch includes all births after December 15th, which encompasses all individuals who conceived after this February 25th date and would have carried their entire pregnancy during the COVID-19 pandemic. After data analysis, we did not discern a trend of lower birth weight across COVID-19 periods or racial categories, as shown in this graph. Neither did we see trends of shorter gestational length across COVID epochs. However, as shown in the table here, we did see a trend of shorter average gestational length among Black and Indigenous American individuals, which aligns with previous literature. We observed a difference in percent of preterm births during the after period for both Black and Indigenous American individuals, shown here. We see a discernible increase in preterm births among Black individuals and a marked decrease among Indigenous American individuals. However, additional analyses are necessary to determine whether this trend is caused by COVID stress, racial discrimination, or other relevant factors. The trends across COVID epochs and racial identity, as described in our study, suggest an unequal impact of the COVID-19 pandemic on Black and Indigenous American communities. To further identify these relationships, we have planned follow-up analyses using robust methods including propensity matching. We must also consider the role of racially based stressors during further analyses of these epochs. This research has been funded by the NIH. Thank you.